Onc Live Insights is a video editorial program produced by Onc Live.
So the cost of managing patients with cancer, the costs, responsibilities as the patient bear are all very important issues that are in the forefront of our minds and in our conversations in these days. The cost of drugs are increasing. Targeted therapies that are approved for these patients, while they're effective, they are expensive. So how do we help keep the costs under control is something that ASCO, NCCN, all organizations, institutions are thinking about. From my standpoint, I think the most important thing we can do is to make sure that we provide the best possible therapies individualized to a specific patient that are most likely to work. And therefore, testing the right patient population, using the right kind of tests, so you're not leaving any mutation or any target that can be treated behind. And the same, on the other hand, you don't want to give a drug that's not likely to work for a patient. So using appropriate technology that is cost effective, that helps provide the information we're looking for a specific patient, and providing the treatment that's most likely to work for them is the best way for physicians to think about in terms of reducing costs associated with oncology care. Now, there are other methods, there are many other things we have to look at, but when you specifically look at treatment strategies for patients with malignant abnormalities, you don't want to miss any patient who has a mutation and give them non-specific therapies that are going to be associated with toxicities potentially and reduced efficacy. On the other hand, giving them a specific targeted drug may actually provide longer survival, better quality of life, lesser hospitalizations, lesser adverse events, and so forth.
Again, one has to be aware of the cost and comparative molecular testing available. The BioT3 or the Cancer Treatment BioT3 platform has been designed to try to control cost. The NGS Plus is used with 50 different genes that have been selected for actionability, mainly for drugs which are already on the market or those in phase 2 and 3 trials. The use of cancer type ID is a test which can determine the cancer type in patients with unknown or unclear diagnoses. This test now, at least in the Medicare in the United States program, it does not charge the patients a copay. Therefore, they'll accept what Medicare covers for the cost of this test. It's important to recognize that many of the molecular tests are becoming less expensive, but the more genes that one requests, the more expensive the test, and often the longer it takes to obtain the results. So I believe that the NGS Plus program has thought this through carefully, and at least for clinical oncologists in the community, obtaining molecular alterations that are known to have actionability and known to be FDA approved, or those that are in phase 2 and 3 trials, makes a lot of sense, not only from the standpoint of being able to treat the patient with a useful therapy, but also trying to conserve resources or save money.